Critical appraisal for quantitative article. Educational campaign to increase knowledge of pressure ulcers. Why was the study done? Was there a clear research question or hypothesis? Actually, no. The research question or hypothesis was not stated. Was there a clear explanation of the purpose of the study? And if so, what was it? Yes, the purpose of the study was to develop a campaign to increase knowledge of pressure ulcers, to improve management of pressure ulcers, to decrease the incidence of pressure ulcers. What is the sample size? How many participants were recruited? 275 female nurses out of 1,480 total nursing staff who were there working. Were there enough people in the study to establish that the findings did not occur by chance? Yes, because P was less than 0.5 in this study. What did the sample look like? These nurses mainly worked in the ER and in the OR. Their ages ranged from 18 to 40 plus, and the average age of the participants was 36 years of age. Are the instruments of the major variables valid and reliable? How were the variables delivered? Variables are measured as before training and after training. A standardized questionnaire was used, and the ratio of the correct answers at the end of the training over a 2-year period to answers before training were analyzed using the X2 test. Were the instruments designed to measure a concept valid? Did they measure what the researchers said they measured? The instruments designed to measure the concept were data analysis software, or SPSS 16.0 software. All data were measured as plus or minus deviation. Data analyzed was the results of standardized training created by a steering group with corresponding tests that each nurse took over a 2-year period, including continuing education in the form of academic work to increase knowledge of pressure ulcers based on the Braden scale, and advanced wound care and wound bed preparation. Were the instruments used by researchers reliable? Did they measure a concept the same way every time they were used? The instrument used by researchers was reliable, as it was the Braden scale for predicting pressure ulcer risk, a widely accepted tool that was developed in 1987 by Barbara Braden and Nancy Bergstrom to assess a patient's propensity to develop pressure ulcers. The purpose of the scale is to help health professionals, especially nurses, consistently assess a patient's risk by examining 6 standardized criteria. How were the data analyzed? What statistics were used to determine if the purpose of the study was achieved? The data from the educational program, including standard assessment, reporting, consultation, prevention, follow-up treatment, and a series of training sessions on pressure ulcers or PU management, were analyzed by the steering committee with an outcome of N equals 25.
Unusual events in the study. Like, did anyone leave in this study? In one department, there were 280 questionnaires that were sent out, and 275 were collected and validated. That's a 98% response rate, so not everyone did respond. And then in another unit, 312 nurses were investigated. And finally, how did the test fit in with the previous research in the area? Did researchers base their work on a thorough literature review? The study assessed the staff's knowledge on treating pressure ulcers, and this was before and after training, because training was a part of the study. The questionnaire was based on relevant literature that was put together by the members of the pressure ulcer steering group, and implemented thorough self-completion and interviews. The question was uploaded into Epidata 3.1, where it was statistically analyzed using SPSS 16.0 software. The study used an effective worldwide measuring tool known as the Braden scale.
Our study purpose is an important issue, and the results will help clinicians care for patients. Pressure ulcers are a huge problem in the healthcare field and can be preventable. Our results showed us different ways that we can educate our patients so that they can do their part to prevent pressure ulcers in the outpatient setting.